What is melanoma?
Well, melanoma is a type of skin cancer. There are several different types of skin cancer that we see. Melanoma isn't the commonest, but it is potentially the most dangerous if it's left untreated. It arises from cells in the skin which give the skin its colour, its pigment, and they're called melanocytes. You see lots of those in moles, but they also occur in normal skin. And when they go wrong, melanoma is the end result. So melanomas can arise out of pre-existing moles, or they can just come out of normal pre-existing skin.
Okay, so changes to look out for in a melanoma, a problematic mole, colour.
There are three critical things that you need to look out for which would make you suspicious that a mole is changing or that a melanoma is arising. And they are rapid changes in shape, size and colour. So if a mole suddenly gets a lot bigger, or its outline becomes a lot more irregular, or it develops different shades of browns or blacks or even reds over a shortish time period, and by short what I mean is over several weeks to maybe 3 or 4 months, then those are things that you need to let your doctor know about. Itching is not such a good discriminator. Itching, in addition to changes in shape, size and colour, is relevant, but itching on its own doesn't usually indicate a great deal. And bleeding, which is another thing that people think about with moles, in melanoma bleeding is only relevant in quite advanced melanoma, when it's got quite thick and ulcerates. So shape, size and colour are the main things.
And crucially, early detection of a change or a problem is
That's
vital.
right. The earlier you can pick up a melanoma, the better the outlook. So if you can remove the melanoma when it's very superficial in the skin, then you can cure it and it won't come back. If you leave it longer, so it's got a root and it can invade into the skin, it's more likely to spread, and once it's spread it can be very serious.
Okay.
So one of the things we do like to teach, obviously to make it a bit easier for people to remember, are the A, B, C, D of things to look out for, and which essentially just highlight most of the things that Tom's just mentioned. But so A being asymmetry, B border, C colour, and D diameter. So as you said, it's suddenly very large. So that's a nice, easy way for people to kind of look at things.
What are the main causes of melanoma?
Well, there's no doubt that the main cause is sun exposure. Sun exposure over a whole lifetime and also episodes of bad sunburn are probably relevant in triggering off melanoma. So the one key thing that we tell patients who've had a melanoma or who we don't want to get a melanoma is that they need to be careful in the sun. In particular, they don't want to burn or spend too much time out in the sun so that they get a deep tan, because there is no such thing as a safe tan, apart from a fake tan. There is some evidence that in a small number of patients who have melanoma that there may be a genetic influence as well, but still sun exposure is the number one key factor.
Okay. Who is most at risk?
The people who are most at risk are people who burn easily in the sun, people who've got fair or ginger auburn hair, people who freckle very easily, people who've got lots of moles already, particularly if the moles are slightly odd-looking ones, what we call atypical moles. If you've got lots of atypical moles, then you've got a higher risk. And people who have had a positive family history of melanoma. So if you've got a parent or grandparents, brothers and sisters who've had melanoma, that may increase your risk. The other group who are at increased risk are people who spend a lot of time out in the sun for their job, farmers, fishermen, and so on.
Okay. How do we minimise the risks of developing melanoma?
Well, sun awareness obviously is one of the most important things, and really just avoiding excessive sun exposure. So, I mean, the key things are really to stay covered up in peak sun hours. So we always refer to staying out of the sun between 11 and 3, and really covering up is the key issue there. Not only emphasising the use of sun creams, but actually covering up is important. So wearing long sleeve clothing, wearing a sun hat. I think sometimes we overemphasise the importance of sun cream without the other safety factors as well. Sun cream is important, but you need to be following the other advice as well. And then also learning what to look out for is essential, but preventing from the start is obviously key, and avoiding the peak sunlight hours and sun exposure.
What is the best message to send to our children and young people regarding melanoma awareness?
Well, I think definitely the key messages there are, particularly from the age groups up until 3 years old, they really do need to be covered up when they're outdoors, and full sunsuits are the ideal way of doing that, with hats. Also not forgetting sunglasses as well. But really that age group shouldn't be exposed excessively to sunlight, because their skin's still very vulnerable. And even from the years onwards, it's best advised to actually cover up. And it would be wonderful if all schools basically actually did have the policy in place in the schools that kids were wearing sun hats at school, and it was also shaded areas were provided, and sun creams provided as well at schools, because not everybody basically has the funds to provide their kids with sun creams, and if they could actually have that provided in schools, that would be brilliant. Part of the problem with the sunscreens is that people rely solely on them, and also often don't put enough sun cream on, so it is about applying adequate sun cream to the areas and reapplying regularly, which is often forgotten, and that needs to be reiterated as well. And also just to remind people as well that it's not only outdoor sun exposure, the use of sunbeds is also another factor in increasing the risk of skin cancers. And yes, that should be minimised. I mean, we should hopefully not be using them at all, but they are out there, and there should be restrictions on the frequency people are allowed to use them.
I think the first thing to say is that I don't want everybody to go indoors and never go out in the sun again. Sun exposure is healthy. Sun exposure helps us to create vitamin D, and it makes us feel good. But we just need to be careful. We just need to know that there are potential side effects of too much sun exposure, moderation in all things. So I want people to enjoy sunny days, but enjoy them with a hat on and with appropriate protection in the sun. And I think we have to be realistic about the incidence of skin cancer, because we know that it's been going up year on year for a number of years now, and it will continue to do so unless we're more careful about how we protect ourselves in the sun. It's a particular problem in Devon and Cornwall. We've got the highest rates of all forms of skin cancer in the whole of the UK, and it's something we can't be complacent about, but we can change that just by being careful. I think we have to do two things. We have to look at primary prevention of melanoma and secondary prevention of melanoma. And what I mean by that is primary prevention is stopping it from happening in the first place, stopping people from getting melanoma. And that is about sun protection and the simple sun safety advice that we give to people, particularly young people, children at school, and young adults who have quite high levels of sun exposure at critical times in their lives. That's the first thing we need to do, and that's a public health message that needs to go out to schools and to young people. Secondary prevention is about picking up melanomas early, before they have a chance to spread. And if we can pick them up early, we can cure them. And that's about education again. It's about educating generally young adults and older adults as well about what to look for in changing moles, new blemishes on the skin, so that they can present early to their GP, and then they can come and see us and we can deal with them and manage them.